she was kind of like a puzzle. We had pieces here. We could say motor disorder, speech and language disorder, verbal apraxia, still not toilet trained, but it was like something's got to pull this together. You just knew it. I mean, we just knew in our hearts that there was something else going on.
So this is a project here at HudsonAlpha. It's a research and clinical project that we are working on, and our goal is to diagnose children that have unexplained neurological diseases.
She never really had medical issues like, heart problems or anything that you would link together with a genetic condition. I can remember she was probably about 5 months old, and I was looking at speech charts, and I was thinking, oh, she should be making more sounds by now.
So she was one of the first patients that I was able to request and offer them their participation.
She's 5 years old. I know it's not a delay anymore. I mean, this is a full-blown disorder. The teachers had told me, if you don't get a better diagnosis, we're going to label her as intellectual disability.
And our goal is to use the power of DNA sequencing, of whole genome sequencing, essentially looking at every piece of a child's genetic code. And we try to find genetic explanations for the symptoms that the child is dealing with.
They found that a specific gene had a mutation that correlates with Cornelia-de Lange syndrome.
And this is, I think, a very clear example of the value of genetic testing and really how it can end the diagnostic odyssey for a lot of these families. A lot of times that really helps frame the educational approach, the treatment approach, and sometimes we'll offer therapies that we didn't know should be implemented for that patient.
We had already accepted that. This has been a long journey for us, so we were thrilled with some answers. We're all on the same page now.
The estimate is something like 1% to 2% of children have a significant cognitive or physical disability that very likely has a genetic, at least a contributory genetic factor underlying it. And so our goal is to reach as many of them as possible. And so our expansion effort is really designed to go across the entire state and essentially reach out to every family in Alabama that might be affected.
We're just glad to get answers. We can deal with whatever, but to get an answer that puts it all together this is what we needed. We needed that for our family in general.